Good afternoon, everyone, esteemed dignitaries and dear students. Welcome to the awareness program on the occasion of Rare Disease Day 2024. I am Madhusmita Gogoi, your moderator for today's event. It's an honor to have you all here as we come together to raise awareness and support for those affected by rare disease. Without further ado, let's begin our program. I would like to invite our respected Professor Dr. Bipul Nash, Principal, Royal School of Pharmacy, to deliver the welcome address.
Thank you, Madhusmita Gogoi. First of all, on behalf of Royal School of Pharmacy, I take the opportunity to welcome our today's invited guest, Dr. Ujjwal Chakraborty sir, on the occasion of World Rare Disease Day. And also I would like to welcome all our students to listen to his valuable lectures. And we are hopeful that you will get a fruitful informations throughout these sessions, and how nowadays these different diseases it becoming a rare disease. So we'll get a enlightened talk on this, and Dr. Chakraborty sir, he is the best persons to enlighten us with all the valuable informations with respect to Rare Disease Day, and this day is celebrated in the end of every February month, and this year since it is leap year, so we are celebrating on 29th. Otherwise it is celebrated on 28th February of every year. So rare disease, because we all are part of this medical professions, we work together in a healthcare team. So right from the pharmacists, nurses and the doctors, they are contributing a great to the society for upliftment of our patient communities. So I am hopeful that sir will enlighten us with all the necessary informations how this pharmacy community can take part in spreading the awareness regarding these rare diseases, and how these rare diseases, what are the different control and prevention system, and how pharmacists can take active role in spreading the awareness and also for proper management of these rare diseases. So I hope all the students will listen carefully. You will be cooperative throughout these sessions. If you have any queries, I hope the sir will can answer for that. So thank you once again, sir, for your kind presence, and I am hopeful that it is going to be a great lecture, and it will definitely enrich us with all the required informations which we are expecting from these sessions. So thanking you, over to you.
Thank you, sir. Now it's time to felicitate our esteemed guest, Dr. Ujjwal Chakraborty sir. Sir is a general and laparoscopic surgeon with a postgraduate degree from Assam Medical College. He has gained extensive experience working in esteemed institutions in Delhi and received specialized training in laparoscopy from renowned experts. Sir is currently practicing in Guwahati with a vast portfolio of over 6,000 successful procedures. He excels in laparoscopic interventions and demonstrates expertise in colorectal surgeries, including staple transanal rectal resection. He is known for his expertise in employing advanced techniques for precise and minimally invasive procedures. Please welcome Dr. Ujjwal Chakraborty sir. I would like to invite Professor Dr. Bipul Nath sir, Professor Dr. Prithviraj Chakraborty sir, Associate Professor Dr. Pranavesh Sigdar sir to felicitate sir.
Kind words and a very warm reception I received here. Am I audible? A very warm good afternoon to you all, especially Principal Nath, Professor Chakravarti, faculties, students, ladies and gentlemen. It gives me immense pleasure to be standing before you on the occasion of International Rare Disease Day to deliver a talk on rare diseases. I appreciate the fact, and I have come to know that you celebrate these types of days to bring awareness between students and general public alike. You know, there are two different very difficult things to do in life. One is to climb a wall which is inclined towards you. And another is to talk before an august audience like you who is knowledgeable. Before I start my talk, I just want to narrate a very simple, small story of a rare disease patient which I encountered 5 to 6 years back. Just before COVID, a 30-plus unmarried lady walks into my consulting room with a stack of papers. Those papers were nothing but investigation reports. She comes to me and says, "Sir, I've been having off and on abdominal pain for last 3-4 years." I examined her, went through all the previous investigations. Everything was normal. I admitted the patient and I talked to my medicine specialist. He said that as everything is done, we should investigate her for collagen connective tissue disorder. There's one test you must be knowing, which is anti-nuclear antibody, ANA test. It is a generic test. It is not a very specific test, it's a generic test to find out if the patient is having connective tissue disorder. Fortunately for us and unfortunately for patient, it came out to be positive. Then we send the patient to a center of excellence outside the state, to AIIMS Delhi, where she undergone a battery of tests, and ultimately she came back to us after 1 month with a diagnosis of enteric SLE. You must have heard about SLE. Enteric SLE is very rare. She came to thank us, and she is now on medication. We lost track of the patients. After COVID, we didn't see the patient. Anyway, now let me, the talk which I'm going to give is a huge ocean. I won't be able to finish it in 1 hour. I will try to give you a bird's eye view. It won't be of any granular details. I'm just going to give you an overview of rare diseases. I bring greetings from my place of work. I work in a small hospital called Eastern Nursing Home, and this is our diagnostic facilities where we have more than 50 specialties and super specialties doctors for consultation, and we have all diagnostics under one roof. Now there's a saying by Albert Einstein, if I can explain to you in simple terms, it means that you don't understand it well enough. So I'll try to make it as simple as possible for you to grasp and understand. Now, these are the following headings under which I'm going to talk. What's the definition of a rare disease? What's the rare disease day? Disease burden of rare diseases in the world and in India. List of rare diseases and ultra-rare diseases. Ultra-rare diseases are found only scattered throughout the world. It is in tens and hundreds only. What are first among equals? I will list a few rare diseases which you frequently hear. Now, what are the recent advances in rare diseases? What's the role of government policies and advocacy groups? There are lots of NGOs working on rare diseases. And ultimately, take-home message or the key takeaways. As the name suggests, now what is the definition? I'm sorry for the spelling mistake, because there's a different file actually going on here. Definition, as the name suggests, these are health conditions which have a very low prevalence rate. It affects a minuscule of people. It's defined differently in different countries or within a geographical location of a country. Meaning, I'll give you a small example. Beta thalassemia, which is common in certain pockets in Rajasthan, Haryana, Andhra Pradesh, West Bengal, is rare in South India. So beta thalassemia major is not a rare disease in northern part of India, whereas Duchenne muscular dystrophy, DMD, you must very frequently hear about this name. It is very common in pockets in Tamil Nadu. So it is rare it is common in Tamil Nadu, but it's not rare in northern part of India. So it depends on total number of people affected, prevalence, availability of treatment. It was defined in US in 1983 during Orphan Drug Act. You must be knowing about orphan drug. Yes? Okay. So Europe, it is defined that if 5% is affected in 10,000 people, in Australia in 1 in 10,000 people, in India we have a slightly different definition, 1 in 5,000 people. In the US, less than 200,000 people suffer from rare diseases. Their population is only 20 crore. There are around 11,000 documented rare diseases in the world, and 250 rare diseases are discovered every year, a variant or a new rare disease. So a widely accepted definition would be, a disease is rare if it affects 1 in 2,000 people. This is a standard definition. What is an ultra-rare disease? It affects 1 in 50,000 people. Mind you, 50,000 people. So you can see how less the prevalence is, or you can say the incidences. Now, coming to Rare Disease Day. First observed in Europe in 2008 by EURODIS. EURODIS means European Union Rare Disease Organization. And NORAD, National Organization for Rare Disease, joined this initiative in USA in the same year. We have Organization of Rare Diseases in India. This is a collective umbrella organization which reflects the problem of rare disease patients that they come up with. They have their own goals. I'll come to that later on. In medical curriculum, we have a teaching. It's a common adage. When you hear hoofbeats, think horses, not zebras. Just trying to enlighten you. Suppose in a village, there is one thief, and a theft happened in XYZ's house. What the police will do? The police will go and catch that particular thief. After giving him some third degree, he says, no, I have not done. Then the police will try and find out who is the culprit. So there is one person sitting somewhere in corner of the village, and he turns out to be the culprit. So rare disease is something like that. It has common presentation. We look after all the common causes. Then ultimately, after a very lengthy time, after lots and lots of battery of investigations, we diagnose rare disease. So you have to keep your eyes open, your ears open, everything open to diagnose rare disease. But today it is all about zebras. Zebras are very rare. It's all about zebras whose diagnoses are anything but common. So we are not talking about common diagnosis. Why Rare Disease Day is on the last day of February? It is only logical to observe this day on the last day because we have a rare day on every 4th year of a calendar, that is 29th. It's observed on 28th or 29th day of February each year throughout the world. What is the ultimate goal of Rare Disease Day? To improve lives of individuals with rare diseases, protect human rights, sensitize school with rare disease students. I have my own experience. My known to son is a patient with Down syndrome. It's a rare disease. He goes to school, everybody's outside, demon, the bhoot, something like that. So you have to sensitize. They go out and sensitize students, teachers alike to treat these children differently. They work closely with government, medical fraternities, drug companies to come up with new drugs, to make government work on new policies. They work to raise awareness in public. They work for research, newer developments, newer drug, newer diagnostics, newer biologics, and empower advocacy groups. We'll come to that later on, how they empower advocacy groups. Now, what is the Achilles heel? Achilles heel, I mean, what is the difficulties with these patients? The patient pool is very small. As a student of pharmacology, you know we need huge data samples to come out to arrive to a certain result. Now, if you have 2 samples, the result will vary. Few rare disease patients have only 10 or 100 patients scattered throughout the world. There is scattering of patients throughout the world. As I told you earlier, some disease may be rare in one locality of the same country and it is prevalent. It is not rare on other parts of the country, like, as I said, thalassemia, beta thalassemia, and Duchenne muscular dystrophy. So we lack digital data, but this has changed now. We lack diagnostic biomarkers. So we need to do lots of tests to come to a diagnosis. It's not economically viable for drug companies to develop new drugs, but because the patient pool is so small, drug companies have to spend billions of dollars to develop one drug. Now, who will buy that drug? It's difficult to do RCTs, randomized control trial. This is one of the most powerful tools to find out a drug that works. You know what is RCT? You know what is RCT, randomized control trial? What you do, same group of patients, same disease. To one group you give one drug and to other group you give a placebo. You know placebo? Okay. So it's to find out whether the drug is working or not, or it is just as having a placebo effect. So randomized control trial is a very powerful tool. Paucity of specialist centers and expertise. So we have very few centers. In the West, in most developed countries, they have very few centers. In India, now we are having, but 10, 15 years back, we didn't have any such type of specialized centers to treat this kind of patients. Now, what is the disease burden? How much patients? We don't see any rare disease in the street roaming, but the absolute number is huge. According to Minister of Home and Family Welfare, there are about 7 to 8 crore people with rare diseases in India. Mind you, it's a huge number, it's an elephantine number. In the US, there are 200,000 people with rare diseases. There are about 300 to 400 million people in the world with rare diseases, which constitute about 6% of world population. Most but not all, 80% of rare diseases are genetic. They are scattered throughout the world. Most appear at birth and childhood, and other doesn't appear until late adulthood. Now let me give you an example of late adulthood disease. There's a syndrome called Klinefelter syndrome, where it affects only male, where the cell have an extra X chromosome. Only we get to diagnose when the patient comes to us for infertility. Globally, 35% of death is attributed to rare disease in first year of life. All those who die after birth within first year of life, 35% dies from rare disease. And 30% fails to see their 5th birthday, mind you. Now there are some complex rare diseases. Rare diseases affecting the autonomous nervous system are some of the most complex rare diseases. It's very difficult to diagnose those. They mimic common diseases. How they are named? They are named after the first physician or the first patient. First patient like Lou Gehrig disease. He was the first patient with this. I'll come to that later on. And for patient is Lou Gehrig disease, and physician is, I'll come to that later on when we go into it. On an average, it takes 7 years for a patient in USA to get diagnosed, from his symptoms to diagnosis. Condition in India is very pathetic. Now we have few centers of excellence here, like AIIMS, SGPGI, MAMC, PGI, Kamnani Hospital in Hyderabad, which are equipped to diagnose and treat rare diseases. People with rare diseases stigmatized by the society, as I told you earlier. My a known to son, I have told you earlier, it's a huge burden, financial burden to the society and family. And moreover, less than 10% have FDA approved treatment. Out of 100 patients, 1 out of 10 has treatment. So this is a huge problem. Now let's come to the list of rare diseases. This is a very long list. Acanthosis chorea is a neurological problem. Achalasia cardia, again, is an esophageal problem. Acute inflammatory, you can go through inflammatory demyelinating polyneuritis. There are 11,000 diseases. It's not possible to utter all those names. It will take hours together. So I have just listed few important ones. Addison's disease, it's a disease of the adrenal gland. Adenoleukodystrophy, Alagille syndrome, alkaptonuria, Alzheimer's. You have heard Alzheimer's. People become forgetful. It is rare. Though it is rare in other parts of the country, it is not rare. Here, we frequently come across Alzheimer's patients. Amyloid neuropathy, amyotrophic lateral sclerosis. It's a very important, it's a very disease. I'll come to it later. Engelmann syndrome, anarchia, anterior Honsel disease. It's disease of the spinal cord. Apart syndrome, again, I'll come to that. Arthrogryposis, ataxia, telangiectasia, it is a neurologic disease, polycystic kidney disease. There are lots of cysts, water-filled bodies in the kidney. Aplastic anemia, very dangerous. The bone marrow refuses to manufacture blood components. Banan-Rayleigh-Ruvalcaba syndrome, Bile-duct cystic macular disease, eye disease. Biotinidase deficiency, it is a disease with vitamin B7. Budd-Chiari syndrome, it's a disease of the hepatic veins. Cylindroma, Covenant's disease, cerebrotendinous xanthomatosis, Chapel syndrome, Charcot-Marie Tooth syndrome, chronic granulomatous disease. It encompasses again lots of sub-diseases, chronic granulomatous diseases. Cold urticaria, common variable immune deficiency, Code-Roth dystrophy is an eye disease. Congenital glaucoma, there is increase in pressure inside the eye. Congenital myasthenia gravis, muscle weakness. Congenital nephrotic syndrome, where kidney refuses to hold the proteins. The proteins keep leaking. Creutzfeldt-Jakob disease. Crigler-Najjar syndrome, it's a liver disease. Cushing syndrome, it's a disease of the adrenal. Cystic fibrosis, it can affect all the body organs, especially the lungs. Dentigenous imperfecta type 2. Duchenne muscular dystrophy, which I was talking to you earlier, there's weakness of muscle. Favor disease, it's a inborn error of metabolism. Fragile X syndrome. Friedreich's ataxia, it's a disease of the nervous system. Fructose 1,6 biphosphate deficiency, it is an inborn error of metabolism. Gaucher's disease, it's a inborn error of metabolism. Guillain-Barré syndrome, it's a disease of the nervous system. Hirayama-Hirschsprung, it's a disease, congenital disease of the colon. Hunter syndrome, congenital hydrocephalus, the baby is born with a huge head. Klinefelter syndrome, which I talked to you a little earlier. Lamella ichthyosis, the skin becomes fish-like. Leak syndrome, lipid storage disease again. There's a lots of disease within lipid storage disease. Maple syrup urine disease, there is deficiency, the body inability to metabolize certain amino acids. Meniere's disease is a disease of the ear. Mobius syndrome, Moyamoya disease is a disease of the nervous system. The list is on and on. Let me cut it a little short. We'll go to few diseases. Stevens-Johnson syndrome, you must be knowing. Students of pharmacology must be knowing Stevens-Johnson syndrome. Sturge-Weber syndrome, SLE, which I talked about my patient earlier. It has also got lots of subvariants. THS disease, transverse myelitis, vitiligo, von Hippel-Lindau disease, Wilson's disease, disease of the liver. Now let us come to a few ultra-rare diseases. They are in tens and hundreds, scattered throughout the world. No data. First one is lymphangioliomatosis, pleural parenchymal fibroelastosis, pulmonary alveolar proteinosis, lysosomal storage disease, pulmonary dentiform ossification light cell deposition disorder. Very frightening names. Breed-Hogg-Dubé syndrome and West syndrome. West syndrome is a very severe kind of, the patients suffer from very severe kind of epilepsy. Now, what is achalasia cardia? I talked to you earlier. Now, I'm going to discuss very few rare diseases which I come across not very frequently. Only a year ago, I operated one of such patients, achalasia cardia. It's a swallowing disorder. Patient cannot swallow. It is due to loss of nerve cells at the end of the esophagus. The esophagus becomes very tight. The proximal parts dilates. So it could be autoimmune or viral infection. Nobody knows till date. Treatment is always surgical. We divide the circular fibers at the end of the esophagus. This is acanthosis chorea. This is a very diagnostic sign. If you some patient with this, you make a mental diagnosis. This is acanthosis chorea until proof otherwise. This is again this is a loss of brain cells, and the RBCs are deformed. Let's not go to the granular details here. This is primary addition disease, adrenal deficiency in producing aldosterone and cortisol. Cortisol you all know, aldosterone also you know, they are very important hormones. There is loss of muscle, there is dehydration, bone pain. Incidence is around 6 per 100,000 population. The only treatment is lifelong replacement therapy with cortisol and aldosterone. Alkaptonuria, the patient cannot metabolize tyrosine and phenylalanine. These are two amino acids. As a result, hemosynthetic acid builds up in the body, which is excreted in urine, and this is also very diagnostic. The right two are patients with alkaptonuria. Its prevalence in 1 in 100,000 to 250,000. The gene involved is HGD gene. There is a drug which works in around 20-25% of patients in a mild form, nitisinone. You can go as a student of pharmacology and enlighten yourself what is nitisinone. Lou Gehrig disease, this is amyotrophic lateral sclerosis. A very famous person, you know his name? Sir Stephen Hawking, theoretical physicist who has written the book Brief History of Time. Anyone has written brief history, has gone through Brief History of Time? No. So he suffered from this, and he died 2-3 years back, I think, from this disease. It's very rare. There is an experimental drug, sodium phenylbutyrate torarcidiol. It's an experimental drug. It has not come to the market. Mind you, all these experimental drugs are developed by large multinational companies, spending billions and billions of dollars. This is Apert syndrome. This is named after a physician from France, Apert. There is fusion. Now what happens when you are born, the bones are apart. Slowly your bone grows, the brain grows, and to accommodate, the skull also grow. And after some time there is fusion. The baby is born with fusion of the skull bones. So the brain can't grow inside. It is 66 to 88,000 per live birth. There is a gene which is responsible for fibroblastic growth factor receptor, and the treatment is always surgery. You have to release the bone, you have to release the fingers. Polycystic kidney disease. There is a cup, small cups of, just in the picture, there are small cups of swellings with water inside or urine inside. Treatment is with tolvaptan. Tolvaptan, these patients, they secrete lots of sodium. So in order to preserve sodium, because sodium is a very important electrolyte, in order to preserve sodium, we can give tolvaptan. Otherwise, the patient will need renal transplant. Aplastic anemia, very dangerous disease. The bone marrow refuses to form all the components of blood, be it RBC, WBC, anything, and the patient ultimately dies. The only treatment is bone marrow transfusion. There are other supportive treatment like immunosuppressive, anti-thymocyte globulin, but the ultimate treatment is bone marrow transplant. It is a very costly affair. There is a biotinidase deficiency. Now, biotinidase is one enzyme which cleave the vitamin B7 or biotin from its attached protein. So it cannot happen. So there is loss of biotin, and the patient have mostly hair loss. Biotin is very important for skin, hairs, nails. There is mutation of BTG gene. Now treatment is simple. You replaced with biotin 5 to 10 milligram per day for lifelong. Budd-Chiari syndrome, you know, anatomy of liver, there are 3 hepatic veins. Those veins get blocked. So the liver enlarges and because blood cannot come out of the liver. So blood drains through the hepatic veins. So prevalence is the liver become very large, you'll have pain, you'll have jaundice. Medical treatment with thrombolytics and liver, and ultimate is liver transplantation. It's again a very costly affair. Beta thalassemia major. I have talked to you earlier. So in the heme molecule, you have 2 beta rings and 2 alpha rings. And there is mutation or defective beta rings. So the patient doesn't have a good amount of hemoglobin in blood, and you get all the sequelae of anemia like heart failure, pale, swollen, kidney failure, everything. So treatment is again cord blood transplantation. Familial Cushing disease, it's the adrenal produce too much of cortisol. Prevalence is around 2 to 4 per 1 million population. Means 10 lakh population. Treatment is again medical. Let's not go into it. Again, Crigler-Najjar syndrome. It's the patient will present with a jaundice. They are type 1 and type 2. Type 1 is very severe, and type 2 may live up to adulthood. Treatment is liver transplant, no other option. Cystic fibrosis is little common. Now you all know about globulate cells. They produce mucin. Here there is more mucin production, and what happens? It clogs the bronchioles, ultimately leading to lung failure. It can affect all the organs of body, but lung is more affected. It is inherited as autosomal recessive pattern. You know what is autosomal recessive pattern? No? What is autosomal recessive? No. So both the genes, the mother and the father genes are carried by this patient. If you have only the patient have only one gene, he will not suffer from the disease. That is called dominant. Autosomal recessive is both mother also contribute the defective genes and father also contribute the defective gene. Ultimately, the child suffers from that particular disease. This is autosomal recessive inheritance. Fabry disease is a lysosomal storage disease. Let's not go into the granular details. This is Hirschsprung disease. The baby born with a huge stomach. What happens? In the lower part of the colon, there is deficit of ganglionic cells. So it can open. The baby cannot pass stool, cannot pass gas. It gets bloated. So the treatment is always surgical, emergency surgical. We have to open it up. This is the Klinefelter syndrome, which I talked earlier. They carry one extra chromosome. They may not get diagnosed until late adulthood. They may present with some female characteristics. This is maple syrup urine disease. You see the urine and you can make a diagnosis. They cannot metabolize these three amino acids, essential amino acids, valine, isoleucine, leucine. And this patient will pass very sweet smelling urine. It is an autosomal recessive pattern. It occurs in 1 in 185,000 live births. It's very rare. I have talked about Duchenne muscular dystrophy. So there is a protein dystrophin. This dystrophin molecule is needed for contraction of muscle. Now the gene which codes for this molecule is absent in Duchenne muscular dystrophy. They cannot get up when they are seated. They cannot use their arms. So ultimately they have respiratory failure and they succumb to the disease. This patient you must have seen, lots of, you must have seen on the street, with some small tumors spread throughout the body. This is neurofibromatosis type 1 and type 2, a benign disease. People can live throughout their life. Type 1 is you have small tumors scattered through our body, arms, trunk, head, neck, everywhere. Type 2, there is a neurofibroma in the auditory nerve. So that particular patient will need operation, depending on the site of the tumor. Stevens-Johnson syndrome, you must be knowing. Serious skin disease, and this is one condition for dermatologists which they have to attend emergency. It's a serious disease of skin and mucous membrane, lots of blisters, ulceration, patient is in pain. Incidence is 2.6 to 6.1 per million per year. Allopurinol, anticonvulsant sulfonamides are the inciting factor. Treatment is supportive, wound care, or immunologics. Scleroderma, here what's happened, there is thickening of the skin. The body produces antigen against its own, antibody against its own antigen. So there is a lot of scarring, all those collagen gets deposited and you find very thick skin. Incidence is 5 to 56 per 1 million patients. Treatment is phototherapy with methotrexate or cyclosporine. SLE, I talked to you earlier. Autoimmune disease, again it causes widespread inflammation throughout the body. Cause is unknown. Treatment, again it's very rare, it's 3.2 per lakh population. Immunosuppressants and biosimilars like belimumab. Niemann-Pick's disease, it's inborn error of metabolism. Let's not go into the granular details. Now, what are the recent advances in diagnosis and treatment? Research is very slow because we don't have that kind of data. We need to do research. Scattering of population. From the recent COVID pandemic, we earned a lot from COVID pandemic. It's a blessing in disguise. There has been a leap, like you may not remember, long time back we have lots of PCOs, but now all PCOs are gone. We have jumped from PCOs to straight to cell phone. So there is a huge leap, and a few companies has come out with wearable respiratory monitors, which you can wear. A patient with cystic fibrosis, he can roam around and the data is transmitted to a center where they can monitor his respiratory rate, everything. Advanced gene sequencing and single RNA techniques have aided in the diagnosis. Data sharing tools like REDCap and global unique identifiers. Now there are certain institutes which collects all the data for every research institute to share. So people can use these data sharing tools. Now next is gene therapy. Gene therapy means that in the chromosome you have genes who is responsible for a particular type of protein. So if the gene is defective, it will not produce that protein and the patient become diseased. So here they will slice that particular gene, take it out and put a healthy gene. It can be done in two ways, inside the body and outside the body. Inside the body is called in vivo, outside the body is called ex vivo. Then again RNA. RNA you must be knowing, it's important for protein synthesis. So RNA technology changes the expression of a gene by targeting product of DNA transcription. It silences the dysfunctional gene, the gene which is not working or malfunctioning. It silences that, it puts in another gene so that it can take over the function. Now there are newer molecules, the experimental molecules designed in the market were very costly. Roginolisib for uveal melanoma. Melanoma is a cancer of the eye. It is used for myelofibrosis. Recombinant enzyme alpha galactosidase A is used for Fabry's disease. Etraverin for Fabry's ataxia. etanercept for Stevens-Johnson syndrome. Now, what's the role of government and advocacy group? What impacts it has on the society? So in India, we have rare policy, National Policy for Rare Disease in 2017. They released it in the web to get information from the public, and it was implemented only 3 years back in March 2021. Its aim is to lower incidence and prevalence of RD. I don't know how. I collected it from the government website. Access to affordable healthcare, very good. They have come up with very large number of Nidan centers, which will come to you later on. It categorizes RDs into 3 groups, rare disease in 3 groups. Group 1, amenable to one-time curative treatment. Group 2, this group of patients will need lifetime treatment. Group 3, they have definitive treatment, but lifetime and the treatment is very costly. It gives financial support up to 50 lakhs for treatment at COE means Center of Excellence. We have, in India, we have around 30 Center of Excellence now who are well equipped to treat rare diseases. Setting up of Nidan Kendras for genetic testing and counseling. Now, genetic testing is a very laborious exercise. So they have set up Nidan Kendras. They have made provisions for research and drug development. PLI 2, PLI, you know? No. You are from pharma, you must be knowing. Productive link incentive. So this is an incentive government gives to industry. It has given this incentive to industries for manufacturing of orphan drug. You know orphan drug. It has exempted basic custom duties on import of medicine and drugs for rare diseases. Now Central Drug Regulatory Authority has made fast-track process of experimental drug, clinical trials, and they have exempted the application fee. Now, what are the advocacy initiatives? There are lots of NGOs. Advocacy means NGOs. They work with government. There's a link between the public and the government. There's a foundation called Pompey Foundation. The one gentleman called Prashant Sirol. His initiative is for lysosomal storage disease. MERD by Vikas and Poonam Bhatt. They are so unfortunate. Their 3 children were born with inborn error of metabolism. So they have come up with MERD. And you know FSSAI, isn't it? Every food package has a stamp FSSAI. So they have now, with their initiative, FSSAI has launched Diet for Life for babies with inborn error of metabolism. They cannot metabolize lipids, they cannot metabolize proteins, they cannot metabolize those group of patients. Now for them, for MARD, FSSAI has come up with Diet for Life. There are other groups like spinal muscular atrophy, DMD, spinocerebellar ataxia, osteogenesis imperfecta. All these organizations, there are 25 organizations, they joined hand to form organizations of rare disease India. It's a national umbrella organization, representative collective voice of rare disease patients. There is another organization called India Alliance. It has 200 clinics and 60 major centers for testing and treatment of rare diseases. Now we have a Indian genetic database of rare diseases at Indian Institute of Chemical Biology. Work done by RD Advocacy Group. Same, raising awareness among policymakers, general public and other stakeholders. You are also a stakeholder. Evaluate and diagnose a suspect. Suppose I suspect, I send to one of these advocacy group, they will do everything for the patients. We have a rare disease registry. Now without data, we cannot come out with good treatment, good diagnostics. So if we have data, we can take out, we can help these patients. Self-help group, group surgeons, address social issue like go to school, go to college, train community health workers to identify suspects, and then send these patients to other centers for treatment. So we must all keep an eye open and accept RD has a major impact on family and society. Though we have around 10 crore patients in India, this number is huge. 10 crore people with RD is a huge number. You as a student of pharmacology can contribute a lot towards new drug development for these unfortunates. We can leverage our huge scientific and IT pool to join hand to find appropriate diagnostics and medicines. I thank you for your patience hearing. I can take few questions if you want, if time permits.
Thank you, Dr. Ujjal Chakraborty, sir, for your enlightening talk. Your words will undoubtedly inspire action in our community. I want to thank you again on behalf of Royal School of Pharmacy. Thank you. Thank you, everyone.